Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is what you need to know about facet joint syndrome. What is facet joint syndrome? Well, every level of the spine has two facet joints. They're about the size of a thumbnail and they do contain cartilage just like other joints, the hip, the knee. Together they allow individuals an impressive range of motion. Even though they're small joints, they can be a tremendous source of pain. So when a facet joint starts to develop pain, or facet joints develop pain in a person due to arthritis, it's called facet joint syndrome. Facet joint arthritis actually starts in the disc space. So when you start to get disc degeneration with loss of disc height, it pushes stresses backwards to the facet joints. And they start to see an abnormal amount of stress, they start to develop arthritis, and that's why facet joint arthritis starts in the disc. Why is facet arthritis more complicated than it is in the hip or the knee? Well, we have an effective hip or knee replacement, okay? We don't have that yet for a facet joint. It's a small joint, it's complicated, biomechanics, and it just has not been developed yet. So there are two facet joints at every spinal level, and usually people have multiple affected with arthritis. So if you think about it, there's over 40 facet joints total. There's only 2 knees and 2 hips. So a lot more involved. Even though they're small joints, they can produce significant pain or none at all. Why do people develop facet syndrome? Most commonly it's from degenerative wear and tear, osteoarthritis, okay? There's post-traumatic degeneration, such as for whiplash. Whiplash is thought to cause pain in the neck from injury to the facet joints. And there's a genetic component that we really don't understand very well. How's the problem diagnosed? Well, history and physical looks good. Imaging studies like x-rays can be highly suggestive, along with CAT scan. Patients may be asymptomatic at a level that shows severe arthritis. It doesn't always correlate, which means that a diagnostic procedure can be extremely helpful, such as with a medial branch block or a facet joint injection. If you put numbing medicine around the joint or in the joint, if that's the cause of the pain, it should relieve it very quickly. Additional treatments that are available for facet joint related pain is anti-inflammatories and Tylenol can be helpful. For short-term exacerbations, opiates may be given. Prescription pain creams can be helpful. Physical therapy and chiropractic treatment. TENS units, which put foam pads on the skin with a slight electrical impulse going through them, that can change the way the brain perceives pain signals. And then spinal decompression therapy, which is where you have computerized intermittent traction. Here's a medial branch block. Basically what you have is you have a nerve root coming out from the spine, okay? And then off of that come these medial branches. And the little nerve endings go up to the facet joint and then they go down to the joint below, okay? So putting a numbing medicine and some steroid around the joint and blocking those medial branches can help with pain tremendously. Putting a needle into the facet joint, a facet intra-articular injection, has also been shown to be beneficial. Now, if these injections work and wear off, this is where we're talking about deadening here and here. Heating these nerve endings up, the medial branches, and deadening them can provide pain relief for 6 to 18 months. This is where the catheter goes for the radiofrequency ablation. You can do multiple joints at one time. A medial branch block has been shown to be 85% effective with an average pain relief in and of itself for about 3 months. Okay? If a person has a radiofrequency ablation, that's 80% excellent results for 6 to 18 months. And studies show that it can be repeated with the expectation of the same result. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet syndrome. The top non-operative pain management in Dallas is through the TEX-PAIN Network. There are several clinics throughout the Dallas-Fort Worth Metroplex, accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the TEX-PAIN Network. Your pain stops here.